Globally, partly as a result of the pandemic, we're seeing increased burnout, stress, mental health issues, and an exodus of employees in the Great Resignation. No workforce has been more challenged these past 20 months than healthcare. So, how can we support our teams and individuals through turbulent times? In our panel session now, we're joined by Pamela Bell, Chief Patient Experience Officer of Valley Health, Hamilton Baiden, President of Heritage Health Solutions, and Rich Jones, CEO of Wellness Partners Group. So let's get straight to it. Good morning, Pamela, Hamilton, and Rich.
Good morning.
Good morning.
Great to have you all with us. Thank you so much for joining us. It looks quite cold and early outside that window there, but it's an absolute pleasure to have all three of you with us. Let's dive straight in because we are running a couple of minutes late because of all the questions we got over the last session. So I want to hear from all of you. And let's start from giving some context. I'm going to come to you first, Pamela. What are you seeing in this space? We're talking about burnout, stress, mental health. Are there any trends that you've experienced in mental health for healthcare professionals in particular?
Good morning. It's so good to be here, and thank you so much for having us. There's so many things happening in this space right now. I think first and foremost, what comes to mind is the way the public is perceiving healthcare professionals. A lot of our staff have verbalized that they have gone from heroes to zeros. People are coming into the organization, angry, frustrated, sort of their, level of anxiety is increased. So staff are feeling that there's a lot of animosity. That's leading to a lot of insomnia. People are exhausted. So much is going on in space, and I will, get to more of that as we go on in our conversation today. But there are a lot of things happening with healthcare workers today as they continue to deal with this pandemic or endemic, as we may want to start referring to it.
Mm-hmm. Thank you, Pamela. Hamilton, Pamela there really highlighted the perception of healthcare workers. That is the trend that she's seeing. What about you? Are you having similar experiences?
Yeah, I mean, it's the way that we look at this, whether it's healthcare workers or it's employees in general, is over the last 2 years, everyone has been stressed to the max. There's a lot of uncertainty going on. And the bottom line is individuals that have great coping skills and know how to deal with that, they get through it in kind of a decent manner. Those that don't, it can turn into a lot of different things. It can turn into, buying stuff online that they can't afford, gambling, drugs, alcohol, anything to ease the pain and the uncertainty that's what's going on. And I agree with Pamela. What we're seeing now is more people are talking about this than ever before. Mm-hmm. And that's a good thing. Even though the reason they're talking about it is a bad thing, the fact that people are actually coming out of the woodwork and having these discussions, it can only lead to positive consequences down the road.
Absolutely, and I think that stigma of talking about mental health has certainly been removed after the last few years, so hopefully that means good things will come from it in the future. Thanks, Hamilton. And so, Rich, over to you. Similar question really to both Pamela and Hamilton. What are you seeing here when we're talking about stress, burnout, mental health? A similar experience?
Yeah, I would second what Pam and Hamilton said. The only thing I would say as a clinician, so I run an EAP program. I see a lot of people in private practice as well. I do think it's a new group of folks that are coming in. It's interesting. It's not necessarily folks with a really long established history of, clinically significant issues. And I think that there's also a desire to be able to talk about this stuff without having to get a label associated with it. We have this kind of traditional way of dealing with mental health and substance use where we wait. Unfortunately, we wait until things get really bad. Then we get into this diagnostic prescriptive kind of model where you have depression, therefore this is what you should do. I'm noticing that there's a different type of client coming in. Somebody who's never sought help before, somebody who really just wants to talk but isn't necessarily down with jumping with both feet into therapy, if that makes sense. It's created a whole different group of folks from my experience.
No, that absolutely does make sense. And Pamela nodding quite emphatically there, so clearly in agreement. But Rich, I want to stick with you on this because we've obviously all seen it. Burnout is increasing, but I'm really interested to hear, as a result, what are you doing to avoid burnout at your organization? Do you have any examples of the things that you're trying out?
Well, I mean, I'll be really frank. We're doing more coaching than we are doing therapy. And coaching is an interesting experience. It's this idea of, frequent touches, shorter in duration, less intensive in terms of like assessment and clinical kind of like applications, a lot of like in the moment type support, a lot of we're in this together, that type of thing, and trying to continue to work on the stigma, right? You got to work on the stigma on different levels. You just have this idea of the stigma, and it's okay to talk about this and let's get it out in the open. That's one level, and we're doing great with that. But then there's this whole other level of like, we're in this together. It's not about this group of like damaged folks who need to go get fixed. How can we help? And a lot of informal support as well. A lot of peer-to-peer support can be helpful in situations like this. And then Hamilton alluded to just like good, solid coping skills, right? Just the way that are you getting enough sleep? Are you getting outside? All that baseline stuff that you can do to help yourself, through the day.
Absolutely. Thanks, Rich. And Pamela, I know that you're doing some really great initiatives over at Valley Health. Can you tell us a little bit more about what these look like and maybe how they're working?
Sure, I'd be happy to. One of the things that we're trying to focus on is understanding that employees that perceive the organization care about them do a lot better in terms of when you measure their overall well-being. So I'm trying to really get that out there with our executive staff and our leaders, is that we need to be out there, we need to be visible when we're rounding, ask people how they're doing. Have a sense of who your people are and what are they struggling with. Maybe they have childcare issues, maybe they're not sleeping, all of these things. But in terms of strategy, there's two key things I want to mention that we've done and that are actually making a difference. One is we have something called It's Your Move. A lot of healthcare organizations have something similar for their employees. It's if you do A and B, you get a discount on your insurance premium. So this year, what we've done is, in addition to having to get a physical and having a certain cholesterol level, you must participate in a resilience session. And these resilience sessions are led by our resilience team members. There are 5 different topics. So you can pick a topic that pertains to you. It might be insomnia. It might be living a work-life balance. It might be just mental health 101, as Rich and Hamilton are saying, that a lot of people are just kind of coming in for coaching and awareness and that general sort of touch point. That's helping people. The other thing that I've done with a colleague is we developed something called the Bell-Kennett model. And what that model does is it works with a group, a team. It could be a team of leaders or just a department or a team that has a relationship with each other. We do 3 sessions over a period of 3 months. We measure where they're at on decompression, on disengaging from work, on sleeping well. We go through 3 sessions with them for an hour and a half for 3 months. Then we measure again to show an improvement. And then at another 3 months out, we measure. And it's really an opportunity to get these teams around the same table to talk about, what are you doing that's all about choice? Are you able to not think about work when you're at work? How are you doing with disconnecting from work communications when you're not at work? And we're doing some real tangible skill building around that and asking them to touch base with each other and sort of make contracts with each other to hold themselves accountable, because we can't keep doing what we're doing and sort of take care of our mental health. We have to sort of pause now and say, we're in this for the long haul. I can't keep working all these hours. I've got to take better care of myself. And it's natural to have insomnia. It's natural to feel exhausted and have anxiety, because as Rich and Hamilton were saying, we are all in this together. So it's a sense of camaraderie as well.
Absolutely, and almost an element of co-design, perhaps, which is really interesting stuff. Thank you, Pamela. And so, Hamilton, moving over to you, I wonder, can you give us some examples of what you're doing over at Heritage to really deliver the right things to avoid burnout?
Yeah, Rich mentioned some things that we're involved in. Coaching is one of those. I think one of the biggest things we're seeing is the use of technology. How do we all get our information these days? We get it on our phone, we get it on our email, things of that nature. So delivering some of these solutions in an easy way that people can get them. No longer is it that you have to get in your car and drive to the clinic or walk into the therapist's office with a t-shirt that says, I've got a drug problem. I mean, it's those things, you know, Pamela made a comment. She goes, we can't keep doing the same thing over and over again if we want to get different results. And, you know, there's stigma attached with driving to the clinic. There's stigma attached with that type of stuff, and it's more difficult. And so use technology to do that. And then the other thing we're seeing, which if people are willing to do this, it really will change the face of all of these things, is have leaders talk about it. And I know we'll probably talk about this, you know, in more detail, but look, I'm a recovered alcoholic. I've been in the healthcare business for 30 years. The first 21 years, I was in active addiction from alcoholism. No one knew it. I got sober, and literally every single person that I come in contact with now knows it because I'm proud of it. And when we have people like me that are in positions that are somewhat high profile and you talk about it, that's where the change will come. And that's really what we believe in and what we're seeing in other trends and other places as well.
Absolutely. Thank you for sharing that, Hamilton. And I'm wondering, can we flip this slightly? Because obviously, if we look to address stress and address burnout and address mental health problems, that will, of course, bring benefits to our people. That's quite obvious. But I wonder, and Hamilton, I'm going to stick with you. If we do address this burnout, what other opportunities are we creating for our organizations?
Oh my God, that's a great question. Well, number one, you're going to reduce the cost of healthcare. You're going to make people more productive. You're going to decrease absenteeism. You're going to decrease, will you decrease or increase? Basically, presenteeism is going to get better, meaning people, when they're actually in their job and they're actually working, they're doing a better job at it. They're going to be happier. People are more productive. There's about a million different things that we're going to do. And from our standpoint, what we're also going to do is we're going to create more jobs. I mean, we run our program, you know, a lot like Rich said, on a peer coaching model. We are creating this new workforce that's out there. We have a ton of people that are in recovery. They believe in the mission, but they haven't had any work to do. And now they're getting an opportunity to actually get jobs and give back, do what they love to do, and get paid for doing it. So we're creating jobs in the process.
Absolutely, the benefits are clearly abundant. And I'd just like to pause our discussion there because one of our audience members actually would like to jump up to share one of their stories in a partnership that they created that really helps with addressing this burnout. So I'm interested to hear their thoughts and get your thoughts on their thoughts after we bring them up. So I'd love to welcome Jim from ProMedica back up to our stage. Jim asked a great question earlier to Dr. Gleason. Hi, Jim. Now, I know you wanted to jump in here because you've got something really interesting to add to the conversation that's happening right now. So please, go ahead.
Sure, thank you. And I unmuted this time, I think. So
Thank you.
ProMedica has partnered recently with a company called Kumanu to provide access to their application, which is called Purposeful. And they are we are pushing this out to our employees across all levels of the company, but particularly focusing on our provider side, which is where I work. And I use it personally. I think it's a great tool. It is a way to kind of focus your thoughts for the day, focus your thoughts on how you feel. It's all, you know, I get a reminder every day to jump on the app. We are seeing adoption among our workforce in small ways. Our EAP program is also directing people going forward to Kumanu's partner app, which is resourceful. But it's a technology-driven platform that helps people build skill sets and focus on their feelings. It's a way to sort of vent to themselves, if you will. And I think the audio, the panelist expression that we have to avoid the stigma is very important because we're seeing a lot of folks, you know, really stressed who never have had that problem before. And it goes to all levels of our staff, from our nurses and medical assistants to our clinician providers. So I just wanted to share that with the group.
No, great. Thank you so much, Jim. Thank you for jumping up. We'll let you go back into the audience now, but really great contribution to the conversation. And so kind of following on from what Jim said, and Rich, I want to jump to you. Jim has highlighted there a piece of technology that's helping, and Hamilton has already stressed how important it is that we integrate technology into our anti-burnout initiatives, for want of a better word. Have you got any examples of something that you've seen work particularly well for you guys over at Wellness Partners?
So here's what's interesting about the technology. I 100% am on board with that. I'm on board with apps. I'm on board with, we use a lot of videos to support education and information. The thing that we have to watch out with all of this is all of it requires a willing client. So there's an idea that a person, in order to get better, they have to be willing. So they have to put stuff into the app. They have to get up every day and get on it. And there will be a certain percentage of folks that will do that, and they will, without question, benefit. But here's something for us to consider. What about the overwhelming majority of people who aren't necessarily following through? How can we assertively reach out to people? How can we create programs where we are mindfully trying to get to the folks that aren't necessarily 100% on board or 100% in? I mean, we have to be honest about human motivation and about how behavior change works. It is an imperfect process. It's one step forward, two steps back. Rich starts his diet or starts his exercise program or starts his new stress management program, and then he quits. And why does he quit? Well, who knows? He just didn't go one day, so it was easier not to go the next day, and then it just gets easy to check out. There's this thing called the abstinence violation effect, which is the human tendency to throw in the towel. When we're not doing what we're supposed to do, we just kind of quit and give up and say, that's not for me. So what can we add to the equation where we're doing a lot to keep the person on the path? You can do that with technology. You can do that with the way that you reach out to folks. Behavioral economics, things like that can be employed and looked at to get that done. You can also do that with human beings who make a phone call to the person and say, hey, I missed you. Where have you been? What's been happening? So I think we have to combine technology with this idea that people don't always do right. And just because we provide the services doesn't mean people are going to show up. So what can we do to proactively engage folks?
No, that's really
That's
interesting.
just something to think about.
Yeah, no, and it is true. It's very easy to engage with the already engaged. It's those disenfranchised folks that are harder to bring on board. And so, Pamela, jumping to you here, following on from Richard's point there, have you got any examples of ways that you've seen you're able to really target and engage with those that perhaps don't want to be engaged with?
Yeah, I mean, that's really a key point. And I think the two examples I would give, are the things that I mentioned earlier, which is a built-in requirement to participate in a resilience module if you want to be a part of the program to get a discount on your healthcare and premium. And the other one is doing team-based sessions where we do it on a Teams format, but you're pairing people up within that capability, and you're also asking for a sort of a group covenant to say, what do you need from your team member to help you with disengaging at work? Do you need to go to the other leader on the other unit and say, look, I'm going to tag team for you this weekend, and you do it for me next weekend, so that I really don't have to sit there and babysit my phone. I mean, one of the realizations that we had from one of our nurse managers was realizing when she went out into the garden on the weekends, she didn't need to carry her phone on her little fanny pack when she gardens. It's like, wow, I really don't need to be literally that connected to work, and I can trust my team members. So it's these kind of conversations and sort of peer support and peer pressure, if you will, that we're finding really helps.
Absolutely. Thank you, Pamela. Really interesting stuff there. And Hamilton, I want to jump to you on that. And it's important, I think, to not trivialize mental health. But I wonder, following on from Pam's point, is there an element of perhaps leveraging gamification? Is that a way that we can make sure that more of our audience are involved with our healthcare initiatives, with our mental health initiatives?
Yeah, I mean, absolutely. I mean, look, everything that we do these days, it seems like, is on our phone, and there's gamification, everything. It's, go watch the documentary about your phone's The Social Dilemma. I mean, all of this is built into what we do every day. So I like what Pamela said. I mean, there is a part of this. Can you require it of employees? That's one way to get it done. I absolutely love what Rich said. And for full disclosure, Rich and I, our companies have worked with each other in the past. So we believe very much in the power of assertiveness, meaning giving the individual, like changing, what we've done really is we've changed the way we look at this. Instead of giving the individual the onus to be responsible for it, put it in the hand of the professional. So it's not up to me if I want to get sober and change my life or drink less to have to do it all on my own. That would be great. If everyone did that, we wouldn't have an issue in this country. But put it on a professional to motivate, to love the person, to not put labels on them, to call them every day, to make sure they're doing okay and to keep them going. You know, you go back to Rich's example. He was talking about if I want to get on a workout plan and then all of a sudden one day I don't feel like doing it. I guarantee if I showed up at Rich's house every morning and grabbed him and said, let's get in the car and go work out, I guarantee he would stick to that workout discipline. And that's really the idea that we have. And I think what we really need to do is we also have to be smart and borrow from other disciplines that are already working. We don't do the same thing every single day. If it doesn't work, we look at what works in other disciplines, whether it's your gamification on your phone, whether it's other disciplines in healthcare, and we bring it to those that need help.
Absolutely, this cross-pollination of ideas, I think, is super crucial. And on that note, again, we have another member of our audience that wants to jump on to share, in particular, the strategy that they've been using at their organisation that really helps with what we're talking about. And this is Dave from Baiden Health. Dave, welcome back. Now, I know you wanted to explore with us some things that you're doing. It'd be really great to hear.
Yeah, and in full disclosure, we don't have any secret sauce here. So what we're doing is we're creating fireside chat opportunities with the executive team and higher level administration. You know, no ties, a little more informal conversations with folks to come and share their burdens with each other and have us be facilitators with those conversations. Because what we're finding is during COVID, as was said earlier, people have sort of gone from hero to zero. And during that time, if they didn't feel like commodities before, they certainly do now. And one of the things we've heard loud and clear from nursing, respiratory, and even in our laboratory services is that they've made this calculation in their head that if I'm a commodity, then my career really is about cost benefit. And so what's happening is you're seeing this giant sucking sound for people and professionals into travel engagements because they're looking at the money more than they are necessarily the vocation. And all of that is a function of pressure in some respects. And where it really gets off the rails are the people that feel, for family reasons or otherwise, they're sort of trapped in their circumstances. And we as organizations have got to help them feel more of a different culture, because let's face it, we've got generations of folks who interact better with the tech than they do with each other. And healthcare, particularly the past 2 years, has become very personal. You know, when you see multiple COVID patients passing away, when you go home and you can't send your kids to school, and all the pressures have just mounted. And what we've tried to do is spin that around to say, you know, we are all in this together. I might be a senior vice president, I might have a different position, but I get up every morning and put my pants on just like you do, and I've got family issues, and let's figure out this together. And just by expressing it, you know, we are not counselors, but we certainly can, as has been said, be coaches. And that has gone a long way, because we've had people circle back from travel engagements and say, you know, I'd rather participate in the core of the team that I know than be somewhere that I don't. And again, that's just, you know, food for conversation. It's not anything secret.
No, that's great. And so you've seen then generally the response to those fireside chats has been super positive.
Yes, absolutely. That one of the things that we also have learned is we need to be more transparent, because organizations make decisions a lot of times, and we think, well, that's not something we can share because it can't be digested. The opposite side of that calculus is also true. When you don't share rationales and things like that with folks, even if they're difficult, they begin to make up things in their own mind, and that becomes part of scuttlebutt around the organization, and it's poisonous. And in the environment we've had the last 2 years, that's the last thing we need.
Absolutely. Thank you so much for jumping up, Dave. Great stuff. Really appreciate you sharing that. Every little helps, and that is why we do these types of events, to really share best practice and experiences. There's something else I wanted to dig into, and this is particularly interesting for those that tend to like to use data and metrics and analytics to drive decision making. And Rich, I'm going to jump to you first because we've talked about the challenges we're facing. We've talked about how burnout is obviously increasing. People are talking about it. We want to get people talking more. We want to find solutions. But how can we actually quantify success in preventing burnout? Is it just that we say, well, nobody's reporting burnout? Does that mean that we've succeeded? Are there any metrics, Rich, that you've been using or that you're thinking of using in your organization?
Well, Hamilton and I have partnered on, we work together a lot with the EAP and then with his, some of the stuff he does in coaching. So we've actually partnered on a thing, and I don't want to steal the thunder on this, but it's called the Resiliency Capital Index. There's also the Perceived Stress Scale. And there are other, I'm sure, even other measurements out there where you can get any given population, employee population, you can get a baseline idea on how people are doing, and you can see improvement. So you can measure it. There are scales and there are valid instruments that have been shown that demonstrate quality of life improving, stress going down, net promoter scores, for example. That's a very simple thing. But it comes back to, will people complete the survey? How do you get people to complete the survey? I love what Pam was talking about around making it incentivized. And all of this stuff is going to require some of that type of thinking. We can send a survey out to our employee population, regardless of whether it's the greatest measurement tool in the world. But if nobody completes it and we really don't have a comparison or a way to evaluate it. But I do think there are a lot of proven instruments out there that can get the job done in this area.
Absolutely. And I guess as well as people actually completing it in the first place, is there an element of dishonesty because they know it's a work thing, it's professional, their colleagues are going to read it? Do people sometimes worry and maybe are not 100% honest with how they're feeling? Great points, Rich. Thank you. So, Pamela, same question to you, really. And Rich has mentioned some great examples of ways that you can actually track and measure, NPS being a huge example. Is there anything that you're doing to really assess how well you're doing at addressing burnout?
Well, like Rich said, there's a lot of tools out there. We're doing something more simple, which is, from our baseline employee engagement survey, we participated in a resilience component in 2020. So that has our baseline measure. We're going to measure it again next year to see if there's been any progress. But in some of the smaller groups where I've been facilitating these sessions, we do measure it, and it has demonstrated improvement. But I think there are other things that we could look at too, like your safety events. Are falls going up or falls going down? Because if people aren't sleeping well, if their minds are preoccupied, or they're having something going on emotionally, then they're going to be less likely to really pull out those safety tools that they know to use. And you might see things like falls increase. I also feel like, being the patient experience officer, we're seeing comments come through our surveys about the staff just didn't care about me. No one really cares anymore. And I think it's because everybody's tapped out. They've already given their all, and they're upset that people aren't getting vaccinated. It's just so much going on. So there's that perception that staff don't care. And then I think if you have people that are doing better in terms of their well-being, it's going to be a better place to work. So that word's going to get out in the community, because in healthcare, everybody knows everybody. And you're going to start seeing more people want to come work at your organization because of what we're talking about really is developing that culture of resilience and care and support for the staff, where we could be real and say, look, I'm not doing too well. I'm really struggling with some anxiety. And word's going to get out. So I think those things are good ways to indicate how well you're doing overall.
Absolutely. Thank you so much, Pamela. And Hamilton, what about you? How are you quantifying success in this space?
Well, Rich already mentioned the measurement that we use, the Recovery Capital Index, and I think it's extremely important that we measure this. I mean, we spend money on programs, we put them in place. If you're not measuring them and figuring out whether or not they're providing value, then you're probably really doing a disservice. But one of the things that was interesting is when you asked that question to Rich, you asked, and I know you were just setting him up for the question, but, or do we just, if people aren't reporting it, then is it getting better? And I realize the way you asked that question, you did it on purpose, but that without question doesn't work. And here's why. I mean, statistics do not lie. And let's talk about substance misuse for an instance, substance misuse and substance abuse. We know that about half of the country now admits that they're struggling or they have a loved one that struggles. And what's really interesting is there was a Gallup poll done pre-pandemic on the family aspect of this. And what it reported was about 1 in 5 employees say they go home to addiction. They're the family members. So you've got 20% of your employees that are going home to this. They're stressed out. And what's really amazing about that, there was a study done by the Snyder Health Institute that said those family members are 5 times more likely to be hospitalized. But what's amazing about all of this is only 10% of people that struggle ever go get help. So you've got, and you can't see this type of stuff. I mean, addiction is no longer the person that lays in the gutter that doesn't have a job. It's all of us. It's people in the community. It's people sitting next to you at work. And God forbid, if you're going home to this, you're stressed out, you're not sleeping well, you're sicker. And so we have to figure out a way to find those people, because there's no code. There's no medical code that shows that I'm married to an alcoholic or my son is struggling with heroin. And so we have to figure out ways to engage with these employees and get them the help they need, because for the last 70 years, we all know I'm not going to raise my hand and walk down the hall to HR and admit that my wife is struggling with alcoholism. It just doesn't happen. And so we can do all of these great things, but waiting until employees raise their hand or seeing if they're going to come forward, that does not work. So everything that everyone's saying about thinking of innovative ways to get to the employee, get them the help, and then measure it is extremely important.
Absolutely. Thank you, Hamilton. And we've got only about a minute left, so I wanted to squeeze in one last question, if I could, and it's to all of you. And it's kind of moving away slightly from the main topic, but it's equally important, I think. And I would love to hear from you. And Hamilton, I'm going to come to you first because it's kind of connected to what you said earlier. As healthcare industry leaders, do you think it's important in the quest to promote the importance of mental health for us to be vulnerable?
Oh my God, 100% yes. Vulnerable and honest. I mean, it is what it is. I mean, I said on this call, I don't know how many people are on here, I'm a recovered alcoholic. Would I have done that 20 years ago? I don't know. I can't answer that question, but it's something that I'm extremely proud of. And there have been people that have come to me that have heard that and have opened up about their own struggles, about struggles of family members, about needing help. And just by saying that and being in the position I'm in, whether I'm the president of the company, whether I'm anyone in the organization, it makes a difference. And so being vulnerable to me as a leader is without question one of the best attributes you can have, because not only does it keep me on track, it helps other people in the process.
Absolutely. So your stance there, pretty clear, 100% absolutely leaders should be vulnerable. Rich, what about you?
Yeah, I would second that. I also think that leadership has to go out of its way to kind of set an example in how we talk about these issues, the language we use. A lot of times you'll get into this thing where, people, let's just take drinking, for example, like people will go out at night. It'll be everybody will, have a really good time. Maybe some guys will be hungover or whatever. And then you'll make comments like, oh, you're playing hurt. Or we have this thing that we'll do within the culture where we kind of tongue in cheek talk about these issues. Or maybe we make statements like, man, she's crazy or he's crazy or whatever. We got to understand that as leaders, those words mean a lot. And people, they're still conditioned, from the last 70 years to handle this, keep it in the closet. Hamilton shared his story. I'm a person in long-term recovery from an opioid use disorder and an alcohol use disorder. It's been 20 years. And when I first got into this, I wouldn't have talked about it either. But I do think it goes beyond just our own issues. It also goes can we really embrace the idea that being a human being is an imperfect experience? And can we set that tone beyond even our own stories? Just the way that we support people, the way we talk about these things.
Absolutely. Thank you, Rich. And Pam, finally, over to you. What are your thoughts?
I agree 100% with both Rich and Hamilton. I mean, I myself am suffering from PTSD as a result of, working during this environment in COVID. And I share that with people, and I give them some, personal examples of things that I'm doing, of what's working and what doesn't work, and how you have to change it up. And I think people need to see that we're real. And, there's this really great phrase that, attention is leadership's currency. So we have to keep talking about this. We have to let our people know that we're real and that we are all in this together.
Absolutely, and a perfect way to summarise, I think, the conversation. We are absolutely all in this together. Such powerful stuff, and I can't thank all three of you enough for joining us, for sharing your stories, and for actually being vulnerable with us today. It's hugely appreciated. Hopefully you can all stick around and enjoy the rest of the show today, but it's been an absolute pleasure speaking with all three of you, so thanks again.
Bye-bye.
Thanks.
Take care.
Thanks, guys.